Hello, my name is Dr. Brian Reid, and I am a naturopathic doctor. And this is a video about using ozone therapy in the field of integrative cancer care. Someone had posted a question in the comment section of one of my other videos about ozone therapy, and were asked the question, does ozone have any application in integrative oncology? And the long it's a very long answer, I suppose, to that question, but the to make a long story short, the answer is maybe. There are some studies, some human clinical trials that have looked at using ozone therapy in conjunction with chemotherapy and or radiation therapy. I'd have to double check that actually about the radiation therapy, but definitely with chemotherapy, using it at the same time. Now, when you look at the trial and you look at the study design, it's not what they would call a really, really well-designed trial. It's a fairly good sized trial. I think there were around 50 patients in the study, which is not a huge study by any stretch, but for a kind of a pilot trial, it's a decent number. There were some positive outcomes seen in terms of patients in the studies not having as many symptoms, but it's not a super well designed study from sort of a when you look at the kind of the gold standards that are set for scientific trials, it was what they would call a low quality study. So there might be a role to play, but to my knowledge, and I have looked, I have not come across research that is of a greater quality than that, suggesting that using ozone therapy in integrative cancer care is necessarily indicated. Now, on the flip side, there have been some studies looking at more animal studies or petri dish studies looking at the impact of ozone therapy and how that might impact the efficacy or the effect of certain types of cancer care treatments. And there are some results that are encouraging to suggest that it could be beneficial, but the data is really just too preliminary to make any conclusions to any extent about how applicable that might be for working with integrative cancer care. Now, the other thing to consider would be, well, what role might ozone play in helping to address the underlying physiological factors that might predispose to cancer cell formation in the first place? Now, as a general caveat, nothing that I'm saying is intended in any way to suggest that ozone therapy has a role in cancer prevention. There have certainly been no trials to that end, so I'm certainly not making any claims in that respect. However, when we look at the circumstantial evidence, if you will, of different factors that seem to be involved in cancer cell propagation. So, for example, DNA damage, which could potentially be more frequent when there's not enough antioxidants in the body, or mitochondrial dysfunction, which can happen for many reasons, one of which is that if there's not enough oxygen in the tissues, if the tissues are hypoxic. Those are two things that ozone therapy can potentially address very well, or can be useful to help to address, because ozone therapy helps to improve tissue oxygenation levels, and it also helps to stimulate the production of more antioxidants in the human body. So kind of from that perspective, sort of looking at the role that ozone therapy might be able to play in helping to promote healthy physiology, which maybe, we don't know because they haven't done the huge human clinical trials, but at least on paper, it could theoretically be helpful to address some of that underlying pathophysiology that might contribute to cancer cell formation. So a lot of question marks. There are some preliminary studies out there. Hopefully over the course of time, someone will fund those studies to actually look into it, because ozone is, in the grand scheme of things, incredibly non-invasive. It is inexpensive, and it's something that could potentially have a really great therapeutic role in integrative cancer care, but just still remains to be seen what that role might be. If there's any questions about this video or any other videos that you've watched of mine, just leave those questions in the comment section. I'll either reply to them or create a video like this to respond to them.